and some of the method you use to heal your eczema. Could you share that with us?
So we use different modalities such as herbs, diet, nutrition, exercise, lifestyle, and different tools to help optimize the body. I also have a background in traditional Chinese medicine. I'm Chinese myself, and I use a lot of people, whether you have any skin condition or any other chronic disease. Again, a lot of these diseases come from the gut. So the gut is really the root cause. And what I mean by that is because the gut houses billions and billions of different organisms, right? Different types of bacteria, different types of microorganisms that we don't see in blood tests. So really how you effectively treat people with chronic disease and looking at their gut is to do this is for people that don't understand. Let me just explain what energy healing is, and then I'll talk about how it'll affect cancer.
Hi. YouTube have two ways to push your channel. With that said, I'm asking you two quick favors. If you like what I'm doing and want to support my growth, please give me a thumbs up so that YouTube could send my videos out to like-minded viewers just like you. 2. I've noticed that 70% of you who have revisited this channel have not yet subscribed. Please hit that subscribe button. That way my channel will grow. And my promise to you is to give you more content with substance just like these. Do we have a deal? Thank you.
Welcome to the Ivy Cancer Podcast, where we discuss cancer, health, lifestyle, and healing. And today is no different. Today we have a guest on this show to talk to us about our healing and our gut. And his name is Dr. Jason Yuan. Welcome to this podcast, Dr. Jason. Thanks for the opportunity to giving us this, to speak to us about our gut and how it can affect us. If someone should click on this video, what advice would you give to them that they could stay? How would they benefit by watching this video?
Yeah, that's a great question, Brian, and thank you for having me on. The gut microbiome, or what I call, your digestive health system, is one of the most important systems in the body. Okay, we understand that the heart is very important, your lungs is very important, but when it comes to chronic disease and developing chronic disease, the gut is usually the first area. And for people that will click on this video and to watch your podcast, I think what the one thing they will take away is to understand the importance of your gut health and how it's connected to so many different areas, not only related to your digestive system, but related to many other systems, such as your immune system, your nervous system, your skin, right? Different aspects of your hormones and your neurotransmitters. So the gut really is the foundation to health.
All right. Thank you for that. On this podcast, we have a tradition, an open tradition and a closing tradition. Because my mom was a praying woman, so I'm doing this on behalf of her. So I normally start my podcast with a word of prayer. Sometimes I ask my guests if they would like to pray. If not, then I will go ahead and pray.
Sure, I will do it.
Thank you. All right, go ahead. All right. So, what is your academic professional background?
Yes, so my background, Bryan, is that in the United States, I'm based here near the New York City area. My main doctorate is in what's called naturopathic medicine. So it's a type of doctor, physician, where we specialize in integrative or holistic modalities. So in addition to prescribing medications and drugs in certain states, we also look at your body as a whole. So we use different modalities such as herbs, diet, nutrition, exercise, lifestyle, and different tools to help optimize the body. I also have a background in traditional Chinese medicine. I'm Chinese myself, and I use acupuncture and different Chinese herbs as well.
What inspired you to become a doctor?
Yeah, well, just like what inspired you to start your podcast, Bryan, I think for me, my inspiration was really I was struggling with my own personal health issues. I went through the conventional medicine, seeing regular medical doctors, and I wasn't really getting the answers I needed. And it wasn't treating the root cause of my health issues. And I had really bad eczema, which is a inflammatory skin disorder where you have itching and rashes and redness. And I had that for basically the first 18 years of my life, 20 years. And I decided to find my own answer, right? Because I couldn't go to someone and it would help a little bit, but things would get worse. So really, it was about taking back my power into
Right,
doing my own due diligence and finding exactly what was going on inside my body.
right. And some of the method you use to heal your eczema, could you share that with us?
Yeah, so speaking of the gut health, right, and the importance of your digestive system, that was one thing that was not so common in medicine, in the early days, even like 20 years ago. I would say that a lot of people, whether you have any skin condition or any other chronic disease, again, a lot of these diseases come from the gut. So the gut is really the root cause. And what I mean by that is because the gut houses billions and billions of different organisms, right?
Right,
Different types of bacteria, different types of microorganisms that we don't see in blood tests. So really how you effectively treat people with chronic disease and looking at their gut is to do a stool test or what's called a poop test, right? And you find out exactly what's going inside your digestive system,
hmm.
what's going inside your gut health, and then you can take the proper approaches to fixing that.
You mentioned because I was once told on this podcast that 90% of diseases start within our gut. Is that true?
I would say it's about there. It's close to that number. In our practice, in our medicine, there's a saying, all disease comes from the gut, which again, it's a saying, but which also connects to the fact that the gut is a very physical organ,
Hmm.
right? It does a lot of things, helps you break down your food, helps you absorb your food. But also, you have to understand the gut is a very emotional type of organ too. So things like stress is one of the biggest hidden perpetrators of chronic disease because
Right,
stress is something that people can't measure by a number,
right,
and some people don't even know if they're stressed, right? They're so used to it. And stress affects the gut very, very, very deeply. So when people say all diseases or 90% of disease comes from the gut, there's both a physical and emotional component to that. So that's why I tend to agree. Yeah.
okay, fair enough. What is gut microbiome? Can you break that down for us?
Yeah. So your gut microbiome. So the word microbiome, micro being a smaller subset of your biome. And the biome basically is a population of life. Okay, so just as I mentioned, your gut houses billions and billions of different types of bacteria. Okay, these bacteria are very important because what I do is I separate it into two categories. Okay, you have your good bacteria, which we know as probiotics, right?
Right.
We'll take probiotics because they want the good bacteria to be in their gut because these good bacteria help maintain a healthy gut because what they produce, what these bacteria do, is that they keep the gut healthy, they support your immune system, they lower inflammation, and they fix and repair the gut. Versus the bad bacteria are the things that causes a lot of inflammation, okay? A lot of these bad bacteria also they are linked to different types of autoimmune conditions, which means it's your immune system attacking itself. Okay. So these bad bacteria, they um they are usually the root causes to many diseases. This also includes things like parasites, worms, yeast, candida, right? All these other things are microorganisms that live in your gut. And because they don't show up on a regular blood test, right? It's very important to find out how much bad bacteria you have and how much good bacteria you have, because that will set the stage for how your health is. And if you don't check this for many years, this is where problems start.
How could we find out? How could we find out? What test do we use to find out how many good or bad bacteria do we have in our bodies?
Yeah, so there are many types of stool or poop tests out there. I would say that's the main way to do it. There are specific ones that I recommend because not only do you want to find out if the good or bad bacteria, if they're there, if they're present, right? But you want to find out how much, okay? How much will determine the treatment protocol that we will take, okay? And this is very important because remember how I talked about probiotics? Okay.
Right.
If someone has good, healthy bacteria, right, and they have good levels of it, and they have some good bacteria that have low levels, well, you wouldn't be able to know that without taking the test, right? So you going out and buying probiotics, right? You are taking a guess that you will have these certain probiotic strains low. Versus if you do the stool test, you will know exactly which probiotics to take because they'll tell you which ones are low. Okay. So that's the benefit. Also, again, when you take the stool test, you will know how much bad bacteria you have. Okay. So certain people will have, some low-grade inflammation, but certain people, especially with very debilitating chronic disease, will have the certain bad bacteria at very high levels. And that's when we want to, again, take the proper steps to address it because there's different treatments for different types of bad bacteria.
So let me get this understanding. Both bacterias are necessary in our body. Is that correct?
It is necessary because you won't have a situation where you have 100% good bacteria. Okay. The ideal ratio I tell people is you want to have about 80% good bacteria and then 20% bad bacteria, right? It's the 80-20 rule.
So
Okay.
how carry on?
Yeah, because when you have that ratio, that 80-20 ratio, your body is able to self-regulate. It's able to
Right.
take care of itself. It's
Right.
just when you have too much bad bacteria, that's when your body can't regulate it and you have to come in to do some changes.
So how do we accumulate? How do we feed our good bacteria so that we can have that 80%?
Yes, so there's a couple ways. The most direct way a lot of people think of is taking probiotics, right? So when you take probiotics in a bottle, right, you're taking those live strains and you're putting it directly into your system. The other ways is to eat probiotic rich foods. So this could include, any fermented foods, kimchi, sauerkraut, kefir, as terms of like diet for yourself.
Right.
Other key thing is to eat fiber and
Fiber.
prebiotic rich fiber because these are called prebiotics because they help feed your good bacteria. So that's how they continue to grow in your system. So there's, different types of fibers you can take to help that grow as well.
Okay. You mentioned earlier about stool test. But how can the color of our poo determine our gut health or
So
stool
this,
tests?
yeah, so the color, it definitely has an impact. It'll show you basically on a general basis how well you are breaking down your food, okay? Or if there's any other issues going on, okay? So, just for an example, if you have very dark, what we call dark tarry stool, okay, that's a sign of a bleed, okay?
Right.
When you have any dark color, that means there's blood that has already have happened. But also if you have more light stool, it means there's some issues with your digestive system where things are not being broken down. Okay, so not only color, but you'll see undigested food in your stool. Okay, a lot of people don't check it because they don't want to look at it. But it's very important to look at that because a lot of people will have fat in their stool, which is called steatocrit. And if you're not breaking down your fat, that's an issue because that will come out in your stool. And one of ways to check this as well is to do the stool test.
Some of my friends or my family may be watching this. They probably laugh at me, but I have a tendency when I get up off the toilet, I turn around before I even wipe, I turn around and I look on my stool. Sometimes I do not know what I'm looking for, but if I see anything alarming, I could know, right? So you made mention that sometimes we could see um, certain things in our stool. What are some of the things that we could look for in our stool to identify that something is going on inside of our body?
Well, that's a great question, and I do recommend everyone to look at their stools as well because this is something important. It's like when you're checking your body, right? You want to make sure that there's things that are not, again, more alarming, and which the alarming ones are usually if you see any types of worms, any types of parasites present, because again, they kind of live in your digestive system. That's usually a dead giveaway sign. And then not to say that's very common. Of course, these things are more less common. The other thing to also look for again is to look at food. If you have undigested food, and usually the big ones are things that are maybe more tough to digest, like corn. It just is a sign. It's telling you that your body is not able to break these things down. Okay, when your body's not able to break these things down, that means it's not able to break other things down. So you're not absorbing your nutrients, you're not digesting your food, and that's going to cause issues in your body because if you have all this undigested food in your system, it's going to cause further problems. Okay, so those are like the two simple things. Again, with color, like we mentioned, there's and I would refer people to look at what's called the Bristol stool chart. Okay, so not only about the color of your stool, your poop, but the formation, right? If it's well formed, okay, if it's in like little clumps or balls, there are certain issues with that. But you usually want like a well formed stool. So I recommend everyone listening to look up the Bristol stool chart because that will explain, you know, what you see there better than what I can say in words.
Do you have a copy of that stool chart could probably share with us at this present moment?
Yes, I can share. Do you want me to share my screen? Is that
Y-
what you're saying?
Yes, so you could walk us through that stool chart and give us that example.
Okay, let me pull it up. Okay. Do you see this, Bryan?
Right, definitely. I'm seeing it.
Okay, so this is what I mean. It's better. I can't explain it in words, but you have to kind of see it yourself. So usually you want to stand between type 3 and type 4. Okay. Again, if you have anything else, that means there's some things going on. So 1 and 2 is constipation. 5 is lacking fiber. Type 6 and 7, again, that has more of an inflammation picture. That means your gut is inflamed. Of course, with type 7, that's like diarrhea. And usually when you have diarrhea, that means you've eaten something that has, again, your body has rejected. So this is a good chart that I like to, share with people and make sure people understand just the consistency of their stool.
Okay, thank you for sharing that chart with us. You made mention about corn and stuff that we may consume that is not, that our body can't break down. So is it the case that it's unhealthy for us to consume foods that our body cannot break down?
What's the question, Bryan? That there's certain foods that we can't break down?
Right. So you said corn, as for instance,
Yeah.
corn, our body cannot break it down. Is it unhealthy for us to eat food that our body cannot break down?
Well, I would say it's not unhealthy, Bryan. I think it's, again, there's usually with especially when we talk about corn is more of a more difficult type of food for people
Mhm.
to digest and break down fully.
Mhm.
And not to say that it's unhealthy to eat corn just
Mhm.
because you can't break it down. What I'm trying to say is that you don't want this to happen with other things you eat.
Okay.
Okay. So if you're not breaking down your meats, your fats, right, your carbohydrates, now that's a problem, okay? Because you are not absorbing fully all those nutrients because your body needs to break it down basically to metabolize and for you to absorb the good healthy nutrients from them. So that's what I'm more worried about, okay? So eating things like corn, especially if you don't break down any corn, I mean that tells you a lot already. But if you have here and there, that's not too much of a worry for me. But really, it's about the other foods in your diet that I am more concerned of. That if you're not breaking down, we need to support you in that area.
Okay. Um, if I was a twin, they said that twins share a lot. Would be the same for our gut microbiome if we were a twin, if I was a twin?
So no, everyone's microbiome is different because your microbiome is basically affected by not only what foods you eat, but by your environment, by your stress levels, right?
Mhm.
Um, by so many other factors that you are exposed to. Anything you put through your mouth, that will affect your microbiome. So mouthwash, toothpaste, not only just food. This is very, very important. Even if you mouth breathe too, if you breathe through your mouth and not breathe through your nose, that will affect your microbiome. Okay, because again, the microbiome is such a large collection. It's literally all the organisms that you're exposed to. Um, this is why it is so important that people get tested for themselves to find out what is exactly wrong. Because especially with, let's say, two patients, right? They come to me with diabetes, right?
Mhm.
Two patients, same thing, same age,
Mhm.
right? Same gender. Um, they will have two completely different microbiomes, even
Mhm.
though they have the same disease of diabetes.
Right.
It's just that everyone is different, and there's different ways to address it.
Right. So you would, because some people, as you said, if we breathe through our mouth and not our nose, then it can affect us, our microbiome. But what if it's the case that I snore?
So it's similar. It's similar, right? You want to be breathing in and out through your nose, right?
Mm-hmm.
One, because it humidifies the air and it brings more oxygen to your body. When you have more oxygen, you have
Mm-hmm.
better circulation. So when we think of that, it's a very big picture type of concept because when you have better circulation versus not good circulation, that affects everything else in your body. Okay, so these are slight shifts, slight changes to your gut when we
Right.
talk about.
Right. Okay. So this podcast, um, is the foundation of this podcast is cancer, right? And I only just recently opened the platform to speak about other illnesses because it's not just cancer that's affecting the world at large. But, my mom passed from cancer. So that's my main objective, my main topic, to speak about cancer and to spread cancer awareness. But I've seen in one of your podcasts or one of your videos that you post about energy healing and that it can cure cancer. Can you walk us through that, please?
Yeah, well, first of all, again, thank you, Bryan, for mentioning your mom, and my deepest sympathy, and I'm really proud for all the work that you've done. I'm sure, your podcast has really impacted many people around the world
Thank you.
that is going through similar things like you do. So again, my deepest really sympathies there, and again, thank you for having me on and talk about this. So, going back to the energy healing part, so that is more my specialty, to be honest. So,
Right,
um. And I try to be very careful, Bryan, because cure is a very definitive word, right?
right,
I
right.
think what I said in the video was energy healing might
Healing,
fight cancer.
right. Fight
Yeah,
cancer.
might
That's
fight
correct.
cancer.
Right,
So this is for people that don't understand. Let me just explain what energy healing is, and then I'll talk about how it'll affect cancer. Okay.
right,
So energy healing, energy is this idea that there is this vital, invisible energy, this life force around our body. Okay. Just like how when you look at your phone, right? When you look at your phone, it's physical,
right.
right? But what keeps the phone running? It's the
Energy.
charge, the
Right,
battery, it's the energy. Okay.
right,
So that's something that we don't see because it's invisible to our eyes, but it's there. So this type of energy has been around for thousands and thousands of years. Many different cultures have understood this concept of this invisible energy that affects your body. Okay, traditional Chinese medicine, Ayurveda, which is in Indian medicine, native indigenous medicine, shamanism, they've all understood that there's this invisible life force around our body. So what we do with that is very important because when someone's battery is very low on charge, right? Can they do a lot of things? No, right?
not
Because they don't
necessarily. Yeah,
have they don't have
right,
the energy to support their
right,
body. Okay. Now, on the other side, so this is what I call energy deficiency, right? When your battery is low and your phone is about to die and it can't like play games or play a video because it just doesn't have the energy to do it. On the other side, what we have is people with energy congestion. Okay. It's like traffic on the highway, right? You know, have traffic, cars can't move. The energy is not moving in their system, it's stuck. Okay. So when it's stuck, what we need to do is we need to move that traffic. We need to clear it out. Okay. So once you clear out the traffic, you remove the blockage. That's when the body starts healing. Energy healing doesn't heal the body. Energy healing fixes the imbalances. Okay. Basically gives your battery more charge so your
right.
body can do what it needs to do,
Get you.
or it can clear out the blockage.
Right,
Okay. The traffic on the highway. So that's how energy healing works.
right.
Now, when it comes to cancer, there's very interesting research being pushed out now. I'll have to say for everyone, their energy healing research is still very new. Okay, a lot of people don't understand it. If you talk to your doctor, they will probably call you crazy.
Right.
But there is research on it, and it's a growing field. Now, when we talk about cancer, this is very, very important to understand. These studies have been done on mouse models. Okay, so because this is so new, they can't test it on humans just yet.
Mm-hmm.
Okay. But in mouse models, what they find is certain molecular mechanisms is that energy healing is able to not only slow down the growth of tumors, okay, but for tumors that have metastasis, right, which spreads, it actually stops the spreading of the tumors as well. Okay. So this
Right,
is in mouse models. So mouses are mammals, and mammals are very, again, we're humans, right? We're
right,
mammals. So you can kind of connect the idea. But this is just in research. In case studies, or what people have reported from getting energy healing done on them, that people have gotten better from cancer, right? Whether
right,
they was early stage or late stage, they've gotten better, okay, in terms of their lifestyle, in terms of how they move around the world. But some people have gotten complete remission as well. And again, I'm saying this is based on word of mouth, people's experiences, people's testimonials. Okay.
right.
So this is what I mean by energy healing might help you fight cancer or help you just live a better life. Okay. And I've seen it myself. I practice this. I am part of a research organization that studies energy healing. And I find that this is really amazing, Bryan, because how you do energy healing is you don't need anything. You don't need a tool, you don't need a device, you don't need pills, a supplement, a drug. You just need your body, right? It's because our phone has a charge, right? We can affect another phone with a charge. So, like I mentioned, we're just correcting the imbalances in the body, okay? And this is really important to understand because Western medicine looks at the body very like a box, right? Oh, you have cancer. Okay, because you have cancer, you're stuck in this box. Whereas energy, when we look at it, right, this energy can be transformed. Okay, you're not stuck. Your body's just out of balance. So we're just trying to fix the imbalances, and then your body will heal.
Okay. So you walk us through what is energy healing, but how could we do energy healing?
Yeah, that's a great question, Bryan. The best way I recommend is to get trained in this. You can do energy healing on yourself.
Mm-hmm.
There are many different types of energy healing out there,
Mm-hmm.
many different types of practices.
Right.
I'm not saying one practice is better than another practice. You have to go there and you have to try it for yourself.
Right.
Okay. Just because this has been done for thousands of years.
Right.
I practice what's called pranic healing. Okay. Pranic healing. Prana is another name for energy. Okay.
Mm-hmm.
I practice this modality because it is very simple, very easy, and people get results right away. And how I describe it is that once you learn it, it's like following a recipe, right? You
Right.
follow step 1, step 2, step 3. If you're able to follow directions, you are able to get results, okay? And it's so simple that I call it like energy hygiene, okay? Just
Mm-hmm.
like when you get your hands dirty, right? You wash your hands, right?
Mm-hmm.
You take a shower. Same thing for your energy. When your energy gets dirty, you need to clean it as well. And this
Mm-hmm.
is part of maintaining a healthy lifestyle. So
Right.
for me, Bryan, I don't need to take any, like if I get a headache, I don't need to take any like Advil or Tylenol. When I have any like pain in my body, I don't need to take anything because I know that my energy is stuck or blocked or weak in that moment. So I just work on the energy body, and the energy body is a reflection of the physical body. So if you change the energy body,
Mm-hmm.
the physical body will change as well. Okay.
Okay. Very informative. I've been doing some research as well, and as it speak about alkaline and cancer. Do you have any
Yeah.
knowledge on that? Can share with us?
Yes. So basically the premise behind alkaline diets is that the body also is more susceptible to disease when it is in a very acidic environment, right?
Right.
When the pH of the body, right? pH is basically acidity versus alkaline. Alkaline is higher pH, acidity is lower pH. When the body is in a very low or acidic state, it is more susceptible, higher risk for disease, right?
Right.
Because it's more inflammation. When you have a more alkaline diet, a higher pH, basically your body will operate better, right? Because when you look at the types of foods out there, right,
Mm-hmm.
like soda, coffee, alcohol, those are very acidic types of things for your body
Right.
versus fruits, vegetables, whole grains. Those tend to be more neutral to more alkaline for your
Mm-hmm.
body. So it just makes sense when we look at it this way, that the body almost heals better from an alkaline state.
So don't our body produce acid?
Yes, our body produces acid to break down food in the stomach.
What should be our normal body pH?
So this is relative, okay? There are different parts of your body,
Yeah.
okay, that have different pHs. Okay. The
Right.
pH in your stomach is going to be, of course, very, very low because it needs to break down the food. Your
Right.
stomach produces acid to break down your food. But there's also other pHs in different other parts of your body as well. And this is what I'm talking about when we talk about the alkaline diet. It's not about, just drinking alkaline water to help with your stomach's low pH. Your stomach will have low pH to start off with anyway, but it's the different parts, okay? And we're talking about the pH in your blood, the pH in also, especially for women, this is very important. For women, if you have any like vaginal yeast infections, the pH in that area is very important because that will make you more susceptible to, again, different types of yeast infections or other infections, just because for women, that area tends to be at higher risk just because the nature of the environment there. So, but when I talk about the alkaline diet, that we're talking about your pH overall in your body.
Thank you, Jason, for this wonderful podcast. How can people connect with you?
Yeah, well, thank you, Bryan, for having me on. It's been a pleasure to speak. And if people want to reach out to me, they can find me on my social media. It's Dr. Jason Yuan, so doctor as in DR, and that's the same thing for my website, drjasonyuan.com. And also they can email me at drjasonyuan@gmail.com.
And you also have a YouTube channel that's going very well, and I must commend you on that. What makes you start a YouTube channel, though?
And I think again the same thing with your case,
Right.
Bryan, right? You were inspired by your mother's life and journey and how I'm sure an incredible woman she was and how much
She
of an
was,
inspiration and
definitely.
impact she had on you, and you're just trying to reach out and help the world, right? Based on her life and based on what she's gone through, and hopefully transform another life, right? So hopefully another person doesn't have to deal with the pain that you've gone through in seeing her that way, and I definitely commend you for that. And it's the same thing for me, right? I'm just trying to help people. I'm just trying to help people understand that there are other options out there, whether it's for cancer, whether it's for your digestive health, whether it's for stress, that there's other tools, right? And if we know that there's other options out there, we can help so many people, right? Just open their minds and help them live a happier, healthier life.
Right. Guys, if you would do us a good, you could learn a lot on Jason's YouTube channel. He shares a lot of informative information and health healings and stuff. You can go over there. Jason, could you let them know what your YouTube channel is?
Yes. So my YouTube channel is the same thing. It's Dr. Jason Yuan, doctor as in DR.
Okay. All the best, Jason. We have a closing tradition, as I said to you before, where our guests leave an encouraging word for the next guest coming up, not knowing who will be coming up. And your encouraging words is from Satwan Singh, is a problem solved is a problem halved. All right, Jason, you have a good evening and take care of yourself and continue doing the good work.
All right. Thank you, Bryan.
All
Appreciate
right,
it.
bye.
The financial abuse. Is that a thing?
Absolutely. Absolutely.
Explain to us, because I never knew that they could have a financial abuse. Explain that to us.
Okay, so let me paint a scenario for you
Right.
then. So you decide that you're going to leave the perpetrator.
Mhm.
Yeah, you have your children, but the perpetrator may be the one who's the financial provider.
Ah.
So then there are many things he can do. He can